Kidney stone pain is one of the worst pains ever described. Sometimes it can be worse than childbirth pain, and kidney stones are very common. They affect at least 10% of the population. Most kidney stones form silently for years. They grow slowly, quietly, unnoticed inside the kidney, without symptoms. The pain begins only when the stone moves, shifts, descends, and blocks urine flow, and I will tell you how to protect the kidneys from stones naturally. Kidney is the main filter of the body. It filters the blood, cleanses it, removes waste products. And our blood contains many salts, including calcium oxalate, uric acid, phosphorus, and other minerals. Normally, these salts dissolve in water, remain diluted, and pass through urine. But sometimes, when you drink less water, or due to heavy sweating, or high salt intake in the diet, the urine becomes more concentrated. The urine becomes thicker, denser, more saturated. And crystals from these salts begin to bind together, aggregate, form clusters. They first appear as tiny crystals, most often calcium oxalate. When these small initial crystals appear, other minerals attach, layer upon them, accelerate growth. They begin to enlarge, harden, expand. And if the urine remains concentrated, the crystals keep growing faster and faster until they become a stone. These crystals, most of them microscopic, are usually excreted silently in urine. But some crystals adhere, attach, stick to the kidney lining and kidney tissue. In such cases, these crystals remain in the kidney and begin to grow. Kidney stones, while inside the kidney, usually do not hurt. There is no pain at first. The pain occurs when the stone enters the ureter and partially or fully blocks urine flow. The ureter contracts forcefully, inflammation begins, and at the same time, pressure inside the kidney rises and the kidney capsule stretches. All of this causes pain, mechanical pain, muscle spasm pain, inflammatory pain, and this combination produces renal colic. The pain is felt in the flank, the side of the lower back just below the ribs, usually on one side. It is severe, sharp, deep cramping. It comes in waves, surges, peaks, yet it can also persist between waves. The pain can start suddenly out of nowhere, often at night. The intensity may be 8 out of 10, sometimes 10 out of 10, among the maximal pain a person can experience. A person cannot sit still. They move constantly, shift positions, search for relief, but cannot find a comfortable position. This is crucial clinically. For example, in peritonitis or other abdominal diseases, a patient lies still and seeks a comfortable position. In kidney stone pain, the patient constantly moves. The pain can radiate, travel, spread into the groin and testicles in men because the spinal nerves share pathways and the brain interprets pain along these dermatomes. A person may develop nausea and vomiting. The vomiting occurs because severe pain stimulates the vagus nerve, activating the vomiting center in the brain. If the stone is near the bladder, the person may develop frequent urination. Blood in the urine is very common because even a small stone can scrape the ureter lining. If a fever occurs, this is a dangerous sign. It suggests infection in the kidney and is a medical emergency. Generally, small stones cause more pain than large stones because large stones can remain in the kidney silently, while small stones move easily and enter the ureter more often. If the obstruction persists, pressure in the kidney rises, filtration decreases, inflammation increases, and the risk of kidney damage grows. This damage usually develops over weeks, not hours, but the pain is immediate. Stones less than 5 millimeters pass naturally in about 90% of cases. Stones above 8 millimeters usually require intervention. Now let's say what you can do to minimize your kidney stone risk. First, you should increase urine volume to at least 2 liters per day. That means you should drink enough water. On the other hand, you should drink water throughout the whole day, and a glass of water before sleep helps reduce early morning supersaturation of urine, because nighttime urine usually becomes highly concentrated. The second advice is intake less sodium, less than 2 grams of sodium per day, because when sodium intake is high, the urine increases calcium excretion. That means less calcium is reabsorbed, more calcium enters the urine, and the urine becomes more saturated. And calcium is a major player in kidney stone formation. This does not mean that you should eliminate calcium from your diet. Maintaining normal dietary calcium intake, about 1 gram per day, is considered normal and helpful because both low and high calcium intake can increase the risk of stone formation. When you consume dietary calcium, it binds oxalates in the intestines, captures them, neutralizes them, and prevents their absorption. That means oxalate will not reach the kidneys. But very high calcium intake can also lead to calcium oxalate binding inside the kidneys, forming crystals there as well. So with optimal intake, they meet in the intestine, bind in the intestine, and do not bind in the kidneys. Limiting high oxalate foods would be a good idea, like spinach, beets, nuts, and chocolate. But generally, these foods are healthy. That is why the optimal approach is to consume high oxalate foods together with calcium-containing foods. So the third advice is combine oxalate foods with calcium-containing foods. What does this mean? When you eat oxalate-containing foods, such as spinach, nuts, chocolate, tea, beets, and you do not combine them with calcium, the oxalate is absorbed in the intestine, travels into the bloodstream, and reaches the kidneys. The kidneys filter it, and the oxalate combines with urinary calcium, forming calcium oxalate crystals. If calcium is present in the gut at the same time, it binds oxalate before absorption, captures it, neutralizes it, forming insoluble complexes that are excreted in the stool and never reach the urine. So, pairing works in the intestine, not in the kidneys. The best combinations are spinach plus yogurt, nuts plus cheese, chocolate plus milk, beans plus dairy, tea with milk. In these cases, oxalates and calcium are combined together. Taking calcium hours later does not help. If you take calcium supplements, they can also reduce oxalate absorption, but excess calcium without food may increase urinary calcium levels, so supplements should always be taken with meals. The fourth advice is to increase your citrate intake. So what do citrates do? They bind to calcium in the urine, form a soluble complex, and this complex is excreted in the urine. When calcium is already bound, it cannot bind oxalate, and as a result, we get less crystal formation. On the other hand, citrate directly inhibits crystal growth. It reduces crystal attachment to the kidney lining. Citrate acts like an anti-clumping agent for crystals. It blocks aggregation, slows growth, prevents adhesion. Here, we should mention that most kidney stones are calcium oxalate crystals. Of course, there are other types of kidney stones, but here we are discussing the most common ones. Foods rich in citrate include lemon, lime, orange, grapefruit, melon, and kiwi. Lemon and lime have the highest concentration, while kiwi and melon have a lower concentration. If you drink lemon juice daily, it reduces kidney stone formation over time. An effective regimen is 2 tablespoons of fresh lemon juice, diluted in water, taken daily, either in the morning, or better, twice daily, 1 dose in the afternoon, 1 dose in the evening. The evening dose may help reduce overnight urine supersaturation. Citrate does not cause calcium deficiency. It does not remove calcium from bones. It binds calcium only in the urine. It does not reduce intestinal calcium absorption. That is why regular citrate intake and citrus fruit consumption are considered one of the key preventive strategies. This method involves a potassium citrate supplement. It binds to calcium in the urine, forming a calcium citrate complex that is excreted in the urine. This is a stronger method compared to most others. It prevents crystal enlargement, reduces crystal aggregation, reduces crystal attachment to the kidney lining, and it also raises urine pH, alkalinizes urine. It has another benefit. By alkalinizing urine, it also prevents uric acid formation, which is another type of kidney stone. Multiple studies show that potassium citrate reduces calcium stone recurrence in almost 60% of cases, and the stone dissolution rate improves significantly. A typical regimen is 20 to 60 milliequivalents per day, divided into 2 to 3 doses taken with meals. Monitoring is essential, because if the urine becomes too alkaline, it can increase the risk of another type of kidney stone, specifically calcium phosphate stones. So the dose should not be too high. If kidney stones already exist, potassium citrate does not dissolve most existing calcium stones. However, it can dissolve uric acid stones if the urine pH is maintained above about 6.5. Potassium citrate can be taken for years if stone recurrence continues. Potassium citrate is usually very safe. In rare cases, it can cause a high potassium level in the blood, which is especially important for people with chronic kidney disease or heart problems, because high potassium can affect heart rhythm. Remember, if you take potassium citrate as a supplement, not as a prescribed medication, the doses are usually very low. For example, 275 milligrams of potassium citrate equals around 3 milliequivalents, which is not even near a therapeutic effect. So, multiple intakes per day are usually recommended, several times daily, with meals, and ideally one dose in the evening. The sixth advice is that a magnesium supplement may also help. Magnesium binds to oxalates, so less oxalate reaches the urine. Even in the urine, magnesium binds oxalate and reduces urine supersaturation. The best form in this case is magnesium citrate, because it has good bioavailability and also provides the citrate effect. A typical dose is 200 to 400 milligrams of magnesium per day, divided into 2 doses taken with meals, especially with oxalate-containing meals. Magnesium is generally safe for long-term intake, but the daily dose should usually be limited to about 500 milligrams. The seventh advice is to watch vitamin C intake. In high doses, vitamin C can increase the risk of kidney stones because it can be converted into oxalate. If you take more than 1 gram of vitamin C per day, the risk of kidney stones increases by about 30%. In men, this risk may be even higher. The risk is moderate if you take less than 500 milligrams daily. To minimize risk from vitamin C, it is best to limit daily intake to about 500 milligrams. The most effective way is to drink enough water so that the urine is pale yellow. This alone can reduce the risk of recurrence by about 40%. Take vitamin C together with calcium-containing meals. Add magnesium with meals, especially with oxalate-containing foods.